The impact of the opioid crisis towards children. When a child is growing up, they should be experiencing the love their parent has for them ever since in the womb. The attachment of being able to trust their parents with anything, the joy of making new friends, or getting a new toy to play with, the guidance from their parent to do right from wrong. Unfortunately, it is not the same for every child across the nation due to the fact that they are one of the most indirectly affected victims of the opioid crisis, for the very reason why their parents decide to get intoxicated of the euphoria caused by this substance. Hello, my name is Vanessa Dame from the English 112 DAG course from Gaston College, and I'll be presenting how the opioid crisis has been affecting children across the nation. Throughout many years, the opioid crisis has been affecting 4 to 7-year-old children because their parents are highly addicted to the opiates, not knowing or caring about the type of damage they are causing on their children. When parents abuse recreational drugs, they are causing family dissolutions. For what that means is that they are neglecting their child's needs, whether it is not being there for their sick child, not feeding them the right meals of the day, not worrying about their child's education. The results from these actions tend to harm a child's health and future. In addition, it harms the child in a way that they are never going to be able to bond with their parent. Thereafter, if there are more children in a family where a parent overconsumes opiates, the parent tends to put the pressure of being a parent onto their oldest or only child. In that way, their child can take care of them and their siblings, or vice versa, the child take care of them instead of while being high in the euphoria caused by this opiate. Continuing on, as parents keep abusing opiates and risking their lives to get more of this specific recreational drug, their children could witness their parent suffer from a sudden death due to an overdose of the product. Witness their parent get incarcerated for breaking the law, and also be part of being taken away from their parents due to showing signs of child abuse. The results from those actions is that children will be sent to foster care and kinship care. When children lose their parents and they grow up under the care of their family members that decide to step in for them, or under the care of the foster care system, children will also grow up with the fear of not knowing who they really are, living with the trauma of getting disconnected from their emotions. As children are growing up in these toxic environments where their parents abuse opioid prescriptions, there are high possibilities where children could suffer from physical health complications growing up. For starters, it can be an accidental inhalation. Throughout a parent smoking the substance, an accidental ingestion if the substance is laying around in the open for easy access for the affected child, a possible poisoning towards the child due to the high doses that the medication has, turning into an overdose. And lastly, it affects the child's brain growing up, making it more difficult for them to be able to understand school and their emotions. Though opiates affected children physically, this substance has affected children psychologically, making them develop mental health disorders. To begin with, children can start to develop PTSD while growing up due to having to witness more trauma, either after their death or incarceration of their parents, and living through the foster or kinship care system. As children keep on growing up, they also begin to develop high levels of stress that block them from being able to do normal activities or connect with their emotions. Lastly, while children are witnessing their parents get high and harming themselves, children also run the risk of becoming the next victims of opiate abuse. Time to time, more cases of children suffering from the opioid epidemic has increased instead of decreasing. By 2005, about 24% has been opioid-related child death, but after 2018, it has raised over 52%. The numbers of children getting affected by the opioid epidemic keep increasing as seconds, minutes, hours, days, and years are going up by. The numbers mentioned above should decrease. Something needs to be done about this issue. After it has been reported that children have went through the trauma of the opioid epidemic, children should begin to have free counseling in or out of school. They might not feel ready to share their experiences and what they have lived through, but throughout time, they should be able to open up and talk about what they feel. Moving forward, what can help a child is if law enforcement and the school system collaborates with helping children express themselves daily, and also train on analyzing on the signs that children are giving off. Let children know that the school system and the law enforcement or emotional support. Coming up with a solution to help the many children affected by the opioid crisis can take lots of time and patience, but the outcomes of helping children better their lives is what matters the most. To begin with, it is always good to raise awareness throughout the community. That way, a majority of the population can have an idea of what children go through with an addicted parent. Moving forward, if schools can help their students that are indirect victims of the opioid epidemic, foster care systems should also provide more therapy and recovery sessions for victims of this crisis. Then, for parents that are looking to foster a child that is known as a victim of the opioid crisis, they should be getting prepared emotionally to be able to bond with their foster child. As for grandparents that decide to step in to care for their grandchildren affected by this epidemic, grandparents should be able to try to make sure to spend quality time and fix their grandchildren's wounds step by step, making sure their grandchildren feel safe. These are the sources I have used to make this PowerPoint. I hope this PowerPoint was informal and thoughtful. Till next time.